You tell me about yourself and the company.
Well, my name's Erin Beasley, and I'm a clinical manager here at Pinnacle. I have a master's degree in nursing, and I've been a nurse since 1993, and I'm currently working on a master's degree in healthcare administration too, so I've been there, done the school thing for a while, so I understand where you guys are coming from. And you wanted to know about the continuum of care in healthcare in the everyday work.
Yes.
So, I mean, I can tell you the perspective from home care, hospice, and VPA, because we kind of work as a trinity team.
Yeah.
So pretty much the way it works for us is we get a referral from the doctor, and then we go out and see the patient, and we keep in really close communication with the doctor because we have to work under the orders of the doctor. And then we also, do an interdisciplinary team conference basically every 14 days, so a couple times a month, in which we talk about our complete census, which right now is 65 patients. So we sit down as a team, and when I say team, it's registered nurses, LPNs, home health aide, physical therapists, occupational therapists, and speech therapist, and we all sit down and talk about the patient's care so that we're all on the same page. And then hospice, Grace Hospice, which is a sister company of ours, comes to our meetings too with one representative. And so as we're talking about the patient, whether they're improving or declining, would they be an appropriate hospice candidate, that's when we're able to figure out where does this patient need to go on the continuum of care. What's really cool is that we can graduate a patient from home care, because our goal when we go in is to return them to their prior level of function. If they return to that prior level of function, they've markedly improved, we're able to discharge them. If they're not improving, then, excuse me, they're declining, then we can pull in hospice. So it's really nice to have hospice, home care together along with the VPA, because you can take that patient forever. Mm-hmm. You know, whichever direction they're going in, you can take care of.
Yeah, especially since VPA is the doctor company, and then you've got hospice and home health as well.
Exactly.
And then how does the continuum of care actually work for someone like who works with it on a regular basis? Like, is it just the whole 485 process, or is there more to it?
Well, it all starts with the referral, which is a process in itself. And then once we admit the patient, then we get the orders from the doctor, which is the 485, which is basically synonymous for doctor's order. And then we carry out that plan of care, which is another name for the 485. Mm-hmm. So we follow that plan of care, and it's set up for 60 days. So within that plan of care, we're very patient goal oriented. So we want to know from the patient, like, what is your goal? What do you want to accomplish with home care? What are we going to do for you? So it's always patient-centered care. And then as we progress toward the goals, or we don't, I mean, it's kind of, you know, and you talk about the continuum of care, it's kind of like a linear, you know, path. So you're either progressing towards the goals to where you can discharge, or you're declining and you're not meeting goals, so then you're going to look at hospice services, or then we can branch off into skilled nursing facilities, hospital care, you know, the whole, there's so much.
Oh,
but,
yeah.
you know, you just, it depends, and every patient is different. So it's patient-specific care, which is, we are a Medicare certified agency, so we have to work under the Medicare conditions of participation. And a lot of what that is patient-driven care, evidence-based practice, patient-driven care, and every patient you treat uniquely. So it's interesting.
It sounds like it. All right, and then how much care planning are you personally in charge of?
I am in charge of overseeing the care planning. The RN clinical in the field actually does what we call an OASIS, which is an outcomes assessment made by Medicare, CMS, the Centers for Medicare and Medicaid Services. They created this OASIS assessment, which is basically quantitative statistics that they're having our nurses collect for them.
Okay.
So it's like a 20-page tool, and Medicare is looking for certain things. They want to know what kind of home care patients are out there and how are they benefiting from home care. So this tool has to be filled out by the RN.